Hi everyone, Dr. Suneel Dhand, medical doctor. Welcome to another video. Well, we have some breaking news that has caused considerable alarm within the current medical establishment, and it regards something that the current HHS secretary has done, RFK Jr. Now, you might think, if you watched some of the news late yesterday and some of the headlines, that this is something absolutely terrible. They're making out like it's a very bad policy. These are top medical institutions that are very concerned. So what is it exactly that RFK Jr. has done? Well, he has called for all new vaccines to undergo placebo testing. Placebo testing. Wait a minute. I thought that was the gold standard for science in general. What is placebo for anyone who doesn't know? Well, it could be used for any type of medical research or trial involving any medication or new injection. And basically what it means is that when you're doing the trial, when you're testing different groups, when you actually have the active product being given to one group, you have a quote-unquote empty product being given to another. So it might be, say, an empty pill if you're doing a study with tablets, or if it's an injection, it could be an empty saline injection. So you're not giving the active product to one group, and then you give the active product to the other group, and then, lo and behold, you can tell if the intervention was successful. And since I was a teenager, I remember learning that this was the absolute gold standard. So why would the medical establishment and the mainstream media be so worried that RFK is now saying that it should be done for new vaccines? Well, let's take a look here because we have a few headlines which cite this alarm. Here we have from one of our favorites, NPR, RFK Jr. to require placebo-controlled studies for new vaccines. This is hot off the press, and they're talking about how the new administration plans to impose a new testing requirement for new vaccines. But then, they state here, the latest statement triggered alarm among vaccine experts, because this may be another step to undermine confidence in the availability of vaccines. So you got that? Undermining confidence by doing placebo-controlled trials, because apparently you shouldn't do placebo-controlled trials, according to some experts. Let's take another look here. This is from the Washington Post. RFK Jr. will order placebo testing for new vaccines, alarming health experts. The potential change outlined in a statement would require all new vaccines to undergo placebo testing, sparking concerns among medical experts. Well, isn't that great to know? Medical experts and all of these people, I'm presuming, those who occupy top positions at medical institutions, typical academic medical institutions, these professors, they are the ones who are citing alarm because these are the people who are wheeled out on the mainstream media. And take a look at this here. We have some other big headlines across the mainstream media about this worrying development. But there was one headline in particular that caught my attention, and it was from a pharmaceutical publication, one of the biggest pharmaceutical publications out there. Take a look at this here. FDA puts up placebo testing requirement for new vaccines, potentially hitting COVID shot makers the hardest, according to reports. Well, that seems like a bit of a funny headline there. It seems like their particular loyalties lie more with pharmaceutical companies, as you might expect from this type of publication. But it seems weird that anything health-related, instead of focusing on the science and the actual safety, they're worried more about how the pharmaceutical companies may be affected by this statement. And this breaking news yesterday, which baffled me completely as to why people are so concerned about placebo-controlled trials, just reinforced in my mind three particular points, which I've known for a long time, but it's always good to be reminded about them. Number one, as a lot of us know from what's happened over the last few years, is it really about the science? That phrase that the mainstream media and top institutions love, follow the science. Is it really about the science when so blatantly you have something which is gold standard science? I mean, why would anybody fear placebo-controlled trials because they actually tell you if an intervention is working? Is it really about following the science, or is this really a complete joke, as many of us have suspected for a long time? Because anybody who really wants science wants placebo-controlled trials. And number two, this comes as no surprise. We know where the loyalties of the people at the top lie. It is very evident that so many there, and you saw it reflected in one of the headlines, their main concern is what is going to happen to pharmaceutical companies' profits if we introduce gold standard science. That is blatantly obvious to so many people. These people, they don't even try to hide it. If you're even half intelligent, you can see where this concern is coming from. It's not from a true position of caring for health and well-being. It is concern for shaking up the status quo and affecting those all-important profits. And number 3, it reinforces to me that despite the change in administration, where we do have some people at the top who have a different philosophy, I'm not saying that I agree with every single thing that is uttered by a member of the new administration. When you have two professionals together, they will never agree on everything. But what I think is absolutely bloody marvelous is that for the first time, we have some people at the top who are asking questions, which I thought science was all about. Open debate. They're challenging the status quo. People like RFK Jr. and the brilliant doctors, Dr. Bhattacharya and Dr. Makari, who really are asking questions which I don't remember ever being asked. And that is what true science is about. But despite the change at the top, what we have to remember, and I've said this before in many previous videos, the biggest resistance to true change and improving the health and well-being of the population comes sadly from many people with MD after their name. Our top institutions, academic medical centers, are infiltrated, if I can put it that way, but I really mean that, by people who have completely the wrong philosophy. Conflicts of interest galore. And their first question is not, what can we really do for open science? What can we really do to improve the health and well-being of the population? Because so many sick people are out there. Their first concern is, how do we get more pills and injections to people? And this is the broken paradigm. And this is the way that so many top people in medicine think. It is all about interventions. It is all about maximizing the number of pills and injections that we give to people. True science goes out of the window. I've often used this comparison. Now, it may seem a bit funny, but I really believe this. I think that if a comet was hurtling towards Earth, the concern of many people with MD after their name is everybody receiving the shot? What is the shot uptake? How many injections can we put into arms? Because they are so one-dimensional. It is so frigging weird when you think about it. They will neglect everything else and focus on this one thing. And my interest in this is because I am primarily a metabolic health doctor. I am concerned about the metabolic health of the population and the absolute catastrophe that we have on our hands. Why are the people at the top of medicine so obsessed with pills and injections when so many people are sick for other reasons? It is really bloody weird. Sorry, I said bloody twice in this video so far, but it is weird. And again, coming back to the main point, we may have a change at the top of the administration, but those same players, many of which were high up during the pandemic, they are still there. And this is a massive roadblock to change. All right, that's all I've got to say about that. The breaking news and the alarm among experts that real science is being discussed and placebo-controlled trials apparently are to be really feared for all new shots coming out. Absolutely crazy that we're in this situation, but I'm going to use one of my favorite terms again. This is a clown world. But I hope, with time, the pendulum will swing in the right direction, because the truth is always the truth. You cannot hide things for very long. People in the end do wake up if the truth is shoved in front of them enough times. I will repeat again, nobody should have anything to fear from placebo-controlled trials, and these people have massive budgets as well. If time is a concern for them, they can run these trials really, really fast if they want to with their almost unlimited budget. Think about the pharmaceutical companies and their enormous profits. They absolutely have enough budgets to run whatever trial they want with, of course, the right oversight. Make sure that they're not fudging the numbers at all. Okay, everyone, thanks for watching. Let me know what you think about that. And again, I'm a person of open science. Unlike some other people, I don't want to shut down debate. I don't want to censor. If I'm horribly wrong with what I'm talking about, then absolutely let me know. I'm okay with that. I don't mind hearing conflicting opinions, and I don't mind being challenged. So feel free to leave a comment down below. I hope all of you have a great weekend. Stay strong, keep going, and this also reinforces the message that ultimately the best thing we can do for our health and well-being is take our health and our family's health into our own hands. Be awake, do our own research, and do everything natural we can to stay well, because our authorities, too many of these people at the top, don't have the right priorities. All right, everyone, hit the like button if you like this video, the subscribe button for more similar videos in the future. And if you enjoyed this video, you will also enjoy some of my other videos on health and well-being. We will speak again in the next video.